Good to have you with us on this Tuesday. We start this morning with new guidance from the CDC for those who test positive for the coronavirus. If you get COVID but do not show symptoms, you only have to isolate for 5 days instead of 10. But you still have to wear a mask around others for another 5 days after that 5-day quarantine. Now, if you're exposed to someone with COVID and you're vaccinated and boosted, you don't need to quarantine, but you should wear a mask for 10 days after that exposure. As for those just trying to figure out if they even have COVID, it's still hard to get tested or find a test. Many people still have to wait in line for hours to get swabbed. President Biden now saying his administration needs to do better meeting the demand.
But it's not enough. It's clearly not enough. If we'd known, we would have gone harder, quicker if we could have. But we have to do more. We have to do better.
More people who are getting tested are ending up with a positive test result. On average, more than 206,000 people are being infected with COVID every day. A growing number of those positive tests are now among children, including those who are still too young to get vaccinated. Dr. Bob Lahida is joining us this morning to help us understand what those who are testing positive need to know about the new CDC guidance. But first, let's go to NBC News correspondent Ellison Barber with Omicron's impact on kids. So, Ellison, the number of kids testing positive is especially high here in Omicron's epicenter, New York City. How is this current surge impacting kids?
Yeah, I mean, when you look at the numbers, we are seeing a rise in pediatric hospitalizations and COVID positive tests across New York State, but specifically in New York City. The numbers this last week compared to 3 weeks ago, pediatric hospitalizations because of COVID-19 are up 395%. And a lot of those children are under the age of 5, which means that they're not eligible to be vaccinated. Now, one of the questions we have when looking at these numbers and this, what seems to be a very startling increase in the number of pediatric cases, is one thing that we're trying to get some more information from the New York Department of Health on is how those numbers really break down. What are the numbers specifically for children hospitalized solely because they have COVID-19? What numbers do you have for people who were tested as a part of a hospital's procedure when they came into the emergency room for, say, a broken bone? And then finally, what category of children are there because of that post-multi-inflammatory syndrome in children, MIS-C, which typically appears after someone contracted COVID-19, a child 4 to 6 weeks later. Speaking with doctors here in New York City, they say they are specifically seeing a rise in children hospitalized because of COVID-19 specifically and not any of the others. Listen.
97% of the hospitalizations are in children that are not vaccinated with acute COVID illness. So if a parent wants to do right by their child and prevent their child from getting very sick from COVID, they need to vaccinate their child. And they need to vaccinate everyone in the home because most transmissions happen in the home.
And of course, whenever there is an increase in community spread, children who at this point tend to be more among the unvaccinated groups and obviously a little bit more vulnerable because of that, we tend to see their numbers rise as well. But one thing worth noting here is that this is concerning enough to the New York Department of Health that they put an alert out on Christmas Eve warning parents, saying that this is, in their words, a striking increase and urging parents to get their children vaccinated while they're on winter break. Joe?
Ellison, just yesterday, New York City's new vaccine mandate went into effect, and that means kids 5 and up also have to show proof of 1 vaccine dose to get into a restaurant or an indoor venue. How are vaccines going among children?
Yeah, in New York, officials, health officials, public officials, they want to see the numbers a lot higher. A little over 50%, 53.8% of children living in New York between the ages of 5 and 17 have gotten at least 1 dose of a COVID-19 vaccine. 41% are fully vaccinated. So that number, from speaking with public officials, they will tell you that that number is not nearly as high as they would like it to be. Obviously, we see in adults in New York much higher numbers, and they, in New York at least, and in other states, they want to see the numbers in children match a little more closely to what we're seeing in adults, especially at this point in time. Joe?
And Ellison, it's not just New York. What are doctors seeing nationwide when it comes to COVID cases among kids?
Yeah, a doctor in Chicago talked about what they are seeing there. And the answer is a lot of similar things. New York is obviously the epicenter, but other states are looking here to see what's happening now because they worry that they could be in the same place, particularly when it comes to children in the coming weeks. Listen to some of what we've heard.
The kids who we are seeing in the intensive care unit with significant respiratory problems because of COVID infection are adolescents who are unvaccinated. Many of them are obese or overweight, and they're behaving a little bit more like adults with COVID.
You know, Joe, covering this for months on end now, I did reporting a few months ago in Mississippi where they were seeing a particularly concerning increase in children hospitalized because of COVID-19. And some of the response from some people in the community and just people watching would be that, yeah, well, the numbers of children hospitalized because of COVID-19 or the numbers of children dying because of COVID-19, it's not nearly what we're seeing in adults. And the answer I heard from doctors working in pediatric wards at other hospitals, they said, yes, but the vast majority of these deaths and severe illnesses in children are now preventable because we have a vaccine. And in their view, if you can prevent even one child from going to the hospital, they say, why wouldn't you do it? Joe?
Important perspective there. All right, Ellison, thanks so much for kicking us off this morning. Let's bring in Dr. Bob Lahida. He's a professor at the Hackensack Meridian School of Medicine, director of the Institute for Autoimmune and Rheumatic Diseases at St. Joseph Health. Doctor, good morning. So what do you think is behind what we're seeing in this surge of hospitalizations among kids? Is this because of Omicron?
I think it's because of Omicron, Joe, because, we know that Omicron is very sticky and that it infects so readily. And, it's like a radioactive substance. Once you come into contact with it, if you're in a room and somebody's infected, you're darn well going to get infected. And you can be sure of that. And so that's what we're seeing with kids. The kids and families, et cetera. I feel for the children below the age of 5, but those above 5 should be vaccinated. There's no excuse for not taking care of your children. So that is a very important fact. And that's why we're seeing a 31% jump in kids coming into the hospital. And of course, Joe, obesity and other conditions like asthma and diabetes figure into this equation.
Let's talk about the big headline from yesterday, which is the new CDC guidance for isolation period. So if you're not showing symptoms, your quarantine time now cut in half to 5 days. What do you make of the CDC's decision here? And when are people who test positive still contagious? What are we learning about that?
Well, the important thing to understand is that the shortage of airline pilots, EMS workers, fire, police, school teachers, doctors, and nurses are the reason for this backup. If you test positive and you don't have symptoms, you only have to quarantine for 5 days. But you should wear a mask for an additional 5 days. Most of the infections that occur are 2 to 3 days after you develop symptoms. And that is an important fact to understand. You have to wear a mask when you're around people for at least 5 days after you have been infected and become asymptomatic. And you should also get a test before gathering. And that's important, Joe, for the New Year's Eve parties and the New Year's Eve celebrations, if there are going to be any. And a lot of people are canceling their New Year's Eve plans. You should test negative before you take or before you go to one of these parties or events, so you don't spread the Omicron.
Yeah, in the coming days, I think we're going to be asking you and all our doctors for advice on how you're supposed to have those parties, if at all. I want to also ask you about new research from South Africa that shows an Omicron infection makes people more immune against the Delta variant. Do we know why that's the case and what it could mean for protection against future variants?
Well, this is good news in a way, and it's kind of unusual in a way, because if you're positive for Omicron, it seems that there is a 14-fold increase in immunity for the Omicron variant. And studies in a small group from South Africa, roughly about 35 patients, show that there's a 4.4 fold increase in immunity for the Delta variant, which is what we kind of expected. This Omicron variant being very sticky and infecting so many people now, you would say, well, there's got to be some benefit to it, if anything. And the benefit is apparently it provides you with additional immunity against the Delta variant, which, as you know, Joe, is the very deadly variant that we dread to see. And that's what kills people and puts people in the ICU.
Dr. Lahida, because of Omicron, we are seeing a rise in breakthrough cases. So how do you explain to someone who's unvaccinated, who's looking at this and saying, well, hey, vaccinated people are getting COVID? How do you convince them it's still worth getting the vaccine? Then it's worth getting the booster, even if that means they do test positive at some point?
Well, testing positive doesn't mean that you're going to wind up in the ICU, especially if you're vaccinated and you've had the boost. And I hear this from people all the time. The vaccine hesitant say to me, well, I'm not getting vaccinated. What's the point? You get infected whether you are or you aren't. Yes, that is the case, but you are going to be very, very sick. You're going to wind up possibly on a ventilator or dead if you don't get vaccinated and you don't get the boost. We know that the boost is very effective against the Omicron variant, and we have buried in those Omicron infections are people who are still out there with the Delta variant, and the Delta is very deadly. The Omicron less so, but we're seeing more and more people infected. So we're not so sure that the Omicron is somewhat harmless, as people would like to say. It's not harmless. It's deadly unto itself, particularly if you have comorbidities or you're on chemotherapy or you have an autoimmune disease. You've really got to be careful. So the vaccine hesitancy crowd, and I mean, there are a lot of them out there, roughly, 40 million people. This is not logic. You need to be vaccinated and get your booster to protect yourself and members of your family, particularly children, Joe.
Listen to Dr. Bob, always. All right, Dr. Bob Lahida, thanks so much. Appreciate it. Now, COVID is sidelining healthcare workers across the country. So the U.S. military sending reinforcements to hospitals nationwide to help with staff shortages. NBC News correspondent Shaquille Brewster reports from outside one of those hospitals in Indianapolis.
Hello and good morning, Joe. Well, yesterday we heard from President Biden emphasize and talk with governors about the support that he's providing for states. And Indiana is one of those states receiving the support. The U.S. military sending a team of about 20 doctors, nurses, medical technicians to the hospital system that you see behind me, helping him in this crunch. You know, we heard from doctors last week talk about them being in a dire situation, talking about patients ending up in conference rooms at some periods. This hospital system dealing with a 120% capacity right now, which means patients are being sent to locations that they frankly should not be if you listen to what the doctors say. And that's why the U.S. military is coming in. These are medically trained professionals coming in to support much of the hospital staff that we already talked about burnout. We talk about the staffing shortages. This hospital feeling that as well. And look, it is not just the state of Indiana. We're seeing more than 530 members of the military deployed across the country in some 15 states. Those deployments extending even later this week when a new team arrives in the state of Wisconsin. So this is more federal support for those states in those hospital systems feeling as if they need it more than ever. One other thing that we're focused on here in Indiana is the idea that this is not like what you're seeing in New York, in Florida. They're not breaking case records in the way that those states are doing at this point. But despite that, you hear hospital systems and so many people in the area warning that it could get to that point, and that doctors fearing that because there's a larger unvaccinated population here, fearing that that surge that you're seeing in other areas of the country is only days or potentially weeks away from reaching this state. Until then, they're getting that support. This is going to be a 30-day deployment for the 20 members of the military working in this hospital. Again, not just Indiana, but you're seeing this federal support really accelerate in advance all across the country. President Biden saying he plans to send about 1,000 members of the military to hospital systems all across the country. Joe?
Shaq, thank you. Turning now to some breaking news overnight from Denver, where 4 people were killed and 3 others were injured in a series of shootings. Around 5 o'clock local time, police say a gunman opened fire near a tattoo shop in downtown Denver, killing 2 women and wounding 1 man. After law enforcement identified the suspect's vehicle, the gunman fled into the nearby suburb of Lakewood, where police say he killed 1 more person before he was shot and killed by officers. Overnight, Denver's police chief commented on the string of shootings.
This is the holiday season. To have this type of spree take place is not normal for our community. I also want to commend both the Lakewood Police Department and the Denver Police Department for putting themselves in harm's way to bring this person in custody or to stop this spree from continuing.
One Lakewood police officer was injured in the shooting and was undergoing surgery overnight. Police also said no motive has been identified. The investigation is ongoing. Also breaking overnight, a plane crash left a trail of destruction in a Southern California neighborhood. Authorities say the Learjet was bound for an airport just a few miles away outside San Diego when it crashed. It's unclear how many people were on board, but no one survived. Medical examiners are still working to identify the victims and notify their families. The crash damaged a home and several power lines, knocking out power to more than 2,500 residents. Incredibly, no one on the ground was hurt. Holiday travel chaos is still unfolding at airports all around the country. Delays and cancellations are mounting. You can blame a combination of bad weather and airlines struggling to fill the openings in their staff caused by the spread of the Omicron variant. NBC News correspondent Sam Brock has the latest from Miami.
Joe, good morning. As you look at all the activity behind me, there have already been more than 680 flight cancellations domestically today and more than 500 delays. That's on the heels of 1,400 plus cancellations yesterday and 7,700 delays. Flight experts say things should be getting a little bit better in the next couple of days, but then New Year's is a challenge.
It's a brutal 1-2 punch of COVID and winter weather, igniting widespread cancellations and flight delays. Both passengers and crews slowed by the rapid spread of Omicron.
About 4 o'clock in the morning and got to the airport, got on the plane, everything was fine, and then one of the pilots didn't show up. So we had to deplane.
United Airlines says roughly 1 out of every 30 of its flights was canceled Monday. And widespread delays meant fewer than half of all passengers made it to their destination within 4 hours of the expected arrival time. For Delta, weather snarling traffic at key hubs like Minneapolis, Salt Lake City, and Seattle.
It was a pretty tough night. I spent about close to 12 hours in the San Francisco airport.
One Delta flight from Tampa to Atlanta had to deal with potentially criminal behavior.
You got your mask down.
In a sign of the times, a woman berated a man for not wearing his mask while not wearing her mask.
As soon as we get Atlanta, you're going to jail.
It devolved into spitting, punching, and scratching, that woman then appearing in a federal courthouse Monday. Delta saying in part the company has zero tolerance for unruly behavior at our airports and aboard our aircraft. Meanwhile, Airlines for America and several airline CEOs supporting the shorter quarantine time just issued by the CDC for sick crew members. But the Flight Attendants Association has deep concerns.
10 days may not be right for every single case, but it's certainly going to be more right than 5 days would be, where we know that some people would be forced to come back to work while they're still sick.
To create a safer environment for everyone, Dr. Anthony Fauci suggesting it might be time to require a vaccination to fly.
If you want to do that with domestic flights, I think that's something that seriously should be considered.
Dr. Fauci did clarify with Kristen Welker last night that he has not recommended a mandatory vaccination policy for anyone flying to the president. He says there's no decision coming in the foreseeable future. Joe, it's also notable that the U.S. Travel Association has voiced its opposition to that policy months ago. Back to you.
Sam Brock, thank you. That winter weather out west isn't just causing problems for air travel. It's also a headache for drivers on the roads, though it's also bringing some much needed relief to ski resorts. The extreme winter weather is battering areas from Washington to Northern California, and the Midwest could be in for a similar winter blast in the coming days. NBC News correspondent Steve Patterson has more on the travel outlook.
Hey, Joe, good morning. It is no doubt a winter wonderland here, but to those that live in regions that aren't used to this weather, the blustering snow, the brutal cold, experts are advising those people in high-risk areas to just stay inside and stay safe.
This morning, a powerful blast of winter. From coast to coast, over 30 million Americans under winter weather alerts. Storms and snow already blanketing the West, expected in the Northeast and Midwest in the next 2 days. In Northern California, whiteout conditions causing chaos.
It was so bad that it would be basically impossible to get from one exit to another.
Miles of interstate highways shut down, roadways coated in ice and snow.
Well, I'm stuck over here.
Snowpack in the Sierras shattering December records.
This is the most snow we've had in at least in 12 years.
So much snow fell at some Lake Tahoe ski resorts, they had to shut down the slopes. The conditions considered unsafe.
We're happy there's snow, but then again, there's no business.
The Pacific Northwest already blanketed in snow, with more to come. In Seattle, frigid temperatures sending a chill through the region, the coldest in years.
Hopefully it's not around too long.
Parts of Oregon getting pummeled, the governor declaring a state of emergency through the new year.
Too many people that don't know how to drive in the snow.
In the Midwest, blizzard conditions blasting the region, from Minnesota to the Dakotas. In Fargo, near zero visibility as the region braces for bitter cold. Wind chills as low as 50 below zero. Now in the forecast, authorities warn the safest way to ride out the year-end winter weather blitz is to avoid it altogether.
Stay home and enjoy the holiday.
And here in Big Bear, a winter storm warning just expired, leaving nothing but fresh powder on the ground. Great news for those ski resorts in the area, but the roads are still very dangerous as the system now moves east. Joe, back to you.
50 below wind chill. My goodness. Steve Patterson, thanks so much. With that, let's get a check on your morning news now. Weather, Michelle Grossman is with us. Michelle, good morning.
Good morning, Joe. I know it sounds so weird to say. It sounds so weird to say 10 feet of snow, too. I have to check myself a million times. But yeah, that's what we're looking at. Extreme cold. We're also looking at extreme warmth today. Let's, though, start with the snow because we are looking at snow falling today. We could see a foot of snow in some spots. I mean, it really is pretty to look at. But if you're in it in Fargo, North Dakota, you are dealing with lots of snow. You're also dealing with those cold temperatures, wind chills, gusty winds gusting over 50 miles per hour in parts of the west and the northern plains. Otherwise, we're looking at alerts coast to coast from the west all the way to the northern plains, the Midwest, the Great Lakes into the Northeast. 25 million people impacted with that persistent snow across the west. And we're looking at slick conditions in the Northeast. So this is what the setup looks like. Heavy snow and strong winds in the Four Corners, winds gusting over 50 miles per hour. And then tomorrow, you guessed it, another storm moving down the coast. We could see some heavy rain in parts of Southern California. So localized amounts of snow up to a foot of snow. It seems like nothing compared to the 10 feet that some people received in the highest elevations of the mountains, but still a lot of snow, and also up to 2 inches of rain in parts of Los Angeles County. Again, we could see some flooding and some localized flooding in the burn areas. Frigid morning for many, Joe. Again, wind chills as low as 45 below zero. Meanwhile, in the south, we're looking at temperatures in the upper 70s and low 80s for some.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.